Welcome to Tapping Wisdom. I'm Sue Padernacht, and I'm delighted to introduce you to my guest, Dr. Donny, who is the Chief of Pediatric Ophthalmology and Strabismus at UC Irvine Health, Gavin Herbert Eye Institute. He is also a professor of ophthalmology at UC Irvine Ophthalmology School of Medicine and is an active volunteer faculty at Orbis Medical Mission Program since 2000, where he's traveled throughout the world, South America, Africa, Asia, Europe, to provide medical and surgical services and to train ophthalmologists all around the world in up-to-date medical procedures for pediatric ophthalmology. He's also the chief editor at Medscape Online Reference since 2000, where he's published over 100 articles and chapters for peer-reviewed textbooks. And he received his medical degree at Johns Hopkins University and his MBA at Creighton University. I could go on and on about Dr. Saw's long list of awards and honors. It was my honor to meet Dr. Saw at the UC Irvine inaugural Healthcare MBA Summit a number of weeks ago. And as we were talking about his work and my work, we saw some synergies that we thought that would be fascinating for my audience. Dr. Saw, Donny, welcome to Tapping Wisdom. I'd like to ask you to introduce yourself further to my audience and begin a conversation about your work in global health.
Oh, thank you, Sue. First, it's really great to be invited, and as also, getting to know you, Sue, it's been truly inspirational. So it truly goes both ways. So I, as you have said, I've been involved with the medical mission program for many years, and that's one of my passion. My work here is very important, but also my medical mission program, which serves my purpose, and also it's a source of my inspiration. I have really traveled all over the world, and it's been a great pleasure in so many ways. And just like Albert Schweitzer talks about how we all owe someone a gratitude for inspiring us. And for me, my source of inspiration has been my patients that I take care of here, but also all the people that I've met over the years. Is the doctors, the nurses, the technicians, and the patients that I've met over the years through these medical mission programs that truly inspired me, and so it's been a wonderful journey, and I plan to do this till I can't work anymore.
Oh, that's great. So to introduce that quote from Albert Schweitzer, I just want to also do a shameless plug of your autobiography, Catching a Star, in which you also mention this wonderful quote from Albert Schweitzer that kind of encapsulates the experience. And so if I might read it real briefly, at times our own light goes out and is rekindled by a spark from another person. Each of us has cause to think with deep gratitude of those who have lighted the flame within us. So with that context, you speak about Orbis. So if you could tell us a bit about Orbis, the organization, and your leadership and innovation in that organization as you delivered services and trained people around the world.
Yeah, thank you. So I'm truly honored to be part of the Orbis, and it is an international organization, and it was started back in 1980s, and it was a flying eye hospital. It was a concept that was started by a small group of doctors and board members, and instead of us taking the equipment with us to different places, which is very difficult, especially these days, taking all these medications and equipment through the custom at the airport, it's virtually impossible. So we take the equipment to them through a hospital, through an airplane, and where it's fully equipped as a hospital. And we take care of the patients inside the hospital. So the patients would travel to the plane, and then we would take care of them. We would screen them, and we would do surgery, and we would take care of them pre-op and post-op. And while we're doing the surgery, the surgery is being broadcasted. So and videotape. So the people inside the plane, also people in the local community, can be watching the surgery and ask questions simultaneously as I'm doing the surgery. So it is a great resource for the local doctors and great opportunity to learn from each other. It actually truly goes both ways because as I'm doing the surgery, I showed them what is it that we do, but the local doctors would have opportunity to tell me of how they do things differently locally with the limited supplies that they have, so I could learn from it too. So it's an amazing opportunity.
And so how did you come to do this work?
Catching a Star talks about that extensively, and it is an autobiography. So I grew up in a very humble background, like many of your speakers, many of the guest speakers that you have in your program, which I'm actually very honored. Like I said, I'm very honored. So I come from a very humble background, and I grew up. I spent most of my youth with my mom, a single mom. And my brother, three of us, we lived in a small area, we lived in a one-room place. And at the time, unfortunately, my mom had had an eye problem that we could not we couldn't take care of because lack of finance. And so I told my mom at the time, I said, Mom, I'm going to become an eye doctor to take care of people like you. And she says, that's going to be as difficult as you catching a star in the sky. So then I told her, well, that's going to be my goal. So that became my dream. Yeah, that became my dream and my story of hope. And unfortunately, my mom passed away right before I finished my medical training at Johns Hopkins. And her last words were, just don't forget why you became a doctor, because by this time I have forgotten why I became a doctor. I had to work very hard. It was not an easy journey, just like many of your speakers. I worked hard, and by the time that I was about to become one, and I completely forgot why I became a doctor. And then my mom passing reminded me there was a very a pivotal point, I would say, in my life. And then I said, you know what, I'm going to devote my life to help others, and became my mission and vision for everything I do. So I owe a lot to her.
That's wonderful. Yeah. So I'm wondering if you could tell us give us some examples of your participation in Orbis and your leadership of this. I mean, it's grown, quite substantially over the years, and the footprint, around the world has just been so impactful. Yeah. In terms of these children's lives. I mean, I personally did not realize how substantial it was until I really kind of dug into it, and how profoundly diseased, as some of these children's eyes were, and how significant that was for not just their physical, the rest of their physical health and their capability to navigate the world, but also their mental and emotional well-being as well. So I'm wondering if you could tell us some examples of that leadership and innovation, and and maybe a couple of the children who kind of their work has their recovery has inspired.
Yeah, thank you, Sue. So I'm going to tell you, when you work, again, this is truly a teamwork, but when you work in an organization like this, any type of NGOs or any type of organization, leadership becomes extremely important. Without clear leadership and without a clear vision of what the leaders is trying to do, it's really hard to get everyone motivated. And for us, when we go to these places, we get one shot. Like, we're not going there for years. We're only going there for a few weeks at a time. So we only get one shot. So we need to make sure that we are planned, and we have everything organized. So the number one, I would say there are certain things that are extremely important So number one is planning. Without the proper planning, things will just fall apart very, very quickly. And number two, when we are on the ground, when the rubber meets the road, that having that clear leadership, the leadership actually, we like to think that leadership comes from only the leader. That is truly not true. Every member of the team becomes a leader. They become their own leader. But of course, we need to all have a same values and same vision of where we're, of what we're trying to do. But so we all become a leader, and when we talk about, leadership, there are things that are extremely critical. So number one is that if you could imagine, you're going to a developing country and where you have never been to before, and many times that even though you're bringing equipment with you, but there's situations that you just are not prepared, because there are many type of diseases that we just don't see in the States. So, and you go to these places and you see things that you have only heard about, only read about in book. And so you're going to have to improvise, because you may not have the equipment, you may not have the services, the staff may not be familiar with the patient. And also the patients are not familiar with you either. So you're going to have to improvise, and you're going to have to innovate. So as a part of a leadership, innovation becomes very, very critical. In other words, you have to be adaptable. And then number two, you have to find things that, you're going to have to find, you're going to have to use things that were not designed to do what they're supposed to. And you're going to have to be extremely creative to make things work. And it's not just me as a surgeon, but the nurses have to do the same thing. The technicians have to do the same thing. Even the pilots who fly these planes, and sometimes they're flying these planes to places they have never been to before. And sometimes their tarmac may not be thick enough, or they have to make sure that everything's in place before we go there. So we all have to be extremely creative, and we all have to become our own leaders, if you will.
Sounds like there's a profound amount of trust and respect.
Oh, yeah. And so,
well.
yeah, that's exactly right. There has to be a significant amount of trust among each of the members, and respect for this thing to happen. So again, the leadership becomes very important, and then trust, and then the innovative component to make this program work plays a very important role.
So there's a lot of you talked about adaptability, fluidity, flexibility, in terms of adapting to the unknown, of the situation, and that's kind of where your theme of how critical it is to be innovative in these situations, to just be on a continually inventing and reinventing in order to have the impact in all of these different situations.
Right.
Yeah. Tell us about one or two of these children who were kind of their own stories of hope for you. Perhaps their situation was dire and it ended up okay.
Yeah, so I could, that's where I think the story becomes very powerful. All these things are, somewhat theoretical, like the leadership and inspiration and innovation. But the reason we're doing this is for the children that we're helping. And I probably have hundreds of stories, but I'm going to just pick a couple that just come to my mind. So I went to this one particular country that's very remote, and this child had to be brought to me by grandmother, because the child had to be carried, because the child was completely blind and could not walk. And so the child was brought to me, and this poor grandmother was carrying this child who was 7 years old.
I was gonna say, that's a big kid
Yeah.
already for a grandmother.
Yeah, grandmother. But the kid could not walk. So she just had to carry him everywhere, and there was no wheelchair. And we examined the child, and we realized the child was blind from the congenital cataract. And the child had no vision whatsoever. Fortunately, we were able to perform the surgery. Again, there was a lot of innovative component. We didn't have quite the right tools for this type of cataract, so we had to improvise. We had to be very creative to make this thing work. But we're able to complete the surgery with the teamwork. And so very next day, I was going to work, and I saw this little kid running toward me. And I did not know who this child was, because I just never seen this child before. And then he was hugging my leg very tightly, and he would not let go. And then I was asking my interpreter, what happened, what's going on. And then I realized that this was a child that we did surgery the day before. And so he was able to see the following day, and he saw me, and he ran toward me to hug my leg, so that he thought that if he let go of my leg, that he would go blind again.
Oh my God.
He would not let go. And then I looked at him, and I realized that it was a child. So this is a situation where I saw him one day before the surgery, and he had no hopes. His face was completely expressionless, because he had never seen what other people look like.
And that's why you didn't recognize him, because he was
I
so
did not recognize
Yeah.
him. So his facial expression was completely listless, or it was just a completely, a lack of energy. And the following day, I mean, he was just so happy. He could not hide his feelings, and he was smiling, and he was seeing his grandmother for the first time.
Oh,
And so, and then he saw other people walking, and so he started walking the next morning, and then he just ran toward me. And then I just saw him, and he was just smiling, and he was just full of glow. And I told him, yeah, things gonna be okay. Things gonna be okay.
Yeah.
And I had to calm him down.
Yeah.
And then he told me that he wanted to go into medical profession, so he could help other people just like him.
Yeah.
That
So a little bit of a parallel to your early experience. There
Yeah.
was just something personal. Wasn't you that had the eye issue, but it was a
Yeah.
personal experience.
So the impact that this particular child had on me is that, for me to be where I am today, sitting in this chair, being interviewed by you, Sue, some people will call this a miracle. We'll call this a miracle. And I'm going to tell you, Sue, I would probably have to agree with that in many ways. So for me to achieve this miracle, I have received so much love, and so much love, and so many people had to give and make sacrifices, including my mother, including my teachers, my professors. I mean, I could go on and on and on, and many of these people are listed in my book. And so it is truly my time to give back. Moving forward, my goal is to give back and pay it forward, so that a child like this, his name was Jose, a child like this Jose can give back to future generations, and that's how I plan to make this world a little better place than I came in. That's my goal. That's my goal, because it is important to me, not just for me, but for my children and my grandchildren. I truly want to make this world a better place, and it's exciting. It's exciting because there's so many opportunities out there.
And how fortunate we are that
Yes,
that you've had all this good fortune, and you have that perspective, and you're taking all this action. And it makes me think about young Jose. You not only did you repair his sight, but you also repaired his life and his emotional well-being. right? I mean, he's just, his entire life was a trauma, right?
And so,
And what if it wasn't for you, whatever he'll become will never happen.
yeah. Sue, I want to like emphasize that so this was truly a teamwork. You remember this airplane? Let me tell you, think about all the people that go into, like the people who built the airplane. The airplane, by the way, is donated by a private company. And then the pilots and the engineers, all the people. If I could go on and about all the people that, if any one of those people did not act as a leader and take charge and own and have an ownership, this would not have been possible. So number one, and number two point that I want to make is that this is truly a story of hope. So I had my, I'm here because I had hope. Without hope, at least for me, without hope, I don't know how much I could have achieved. So I had hope that things were going to be okay. I had hope that I could make it happen. I could make things happen. And every day I live with hope. And just like that, I was able to give hope to this Jose. And then Jose now is a believer. Now he's gonna try his hardest to make the people around him a better. So that right there, I'm very happy. I'm extremely my heart feels warm just thinking about that.
Yes, absolutely. And so if I could transition a bit, I want to come back to talking about the patients, the children around the world in a moment, but you're saying some very important words about hope. And I also think about the times that I read in your book and the many physicians I've spoken to about burnout. So can you kind of connect the dots for us in terms of, how, coming to do this work with Orbis and doing this global health mission-based medical work, has helped either address burnout in yourself and others that you've seen, your other healthcare partners, right, on your team, or perhaps help to heal some of that.
Yeah, sure. So this is a topic that I gave a lot of lectures on, and just like you, this is something that I study a lot. And I know you have written a thesis on this topic, so I know this is an area that you specialize in. So I'm gonna just say, I'm gonna paint this with a very broad brush. I think the sources of burnout come from different areas, but in a big categories. It can be either intrinsic or extrinsic, extrinsic, and if first of all, if it's extrinsic, then you really have to think about what are the things that you have control over and things you do not have control over. And so I think about if it's something that I have control over, I'm going to focus on it. But if it's something that I really have no control over in immediate near future, then I try not to focus on it too much. Yes, I do think about it. It's in the back of my mind. And I develop a strategic plan to address it down the road. But that's not something that I'm going to dwell on and exert a significant amount of my energy on. For the intrinsic, I think this is where you can really shine. For example, I'm going to give an example. I'm going to say 5 or 6 years ago, I developed a significant neck discomfort due to poor ergonomics. And this is extremely common among surgeons and dentists. As a matter of fact, many of our colleagues are in significant pain or they have retired because of the pain. And the studies have shown, and we have done a survey, 70 to 80% of our colleagues, our own surgical colleagues, are in pain, and they're working 70 to 80%, and they're working through it. And as if a pain is a type of a badge of honor. And that type of mentality needs to change. We do need to change that mindset that pain is okay and that's acceptable. No, your brain is telling you something's not right, and there's a siren is going off, and you need to address it. So this is something that I was the one who was having pain, and this is not something that was extrinsic. That was something that was intrinsic. So with the help of my colleagues, and we were able to develop a surgical loops that would change my posture completely. And also we developed a strap that redistributed the weight of the glasses, because these glasses that we wear during surgery is extremely heavy. So, and also we took, because, with my deep understanding of optics, we're able to acquire some of the prism effect in the glasses, and that also helped with the posture. So with the help of these surgical loops, with a different declination angle, a different angle of the prism, a different angle of the loops, and also with the strap, I was able to eliminate, not reduce, eliminate my back pain completely.
Oh my.
Yeah, this was as of 5 years ago, and without this innovation, I would have retired. I would have retired because this is something that was unbearable. Because of because of this one thing, now I'm able to enjoy life, fulfill mission and vision, and help more people. And just think about that. Just think about that. So the point that I want to make, this is actually a very important point to what you talked about. Whenever you run into a problem or obstacle, and I could and so I could tell you, I could probably write another book just on the obstacles that I had to overcome for me to be where I am today. But think of obstacles as opportunities for you to be stronger, more resilient, and also innovate. And I think that these are some of the very important components of to address burnouts and physician well-being. I cannot emphasize this enough. So obstacles can be opportunities for us to improve and become stronger. And so anyway, so that's one example that I wanted to tell you, and I could go on and on and on.
It's a great example, yeah.
Yeah.
Mhm. Yeah, thank you for sharing that.
Yeah.
So I'm wondering if in closing, you could tell us a little bit about your your kind of conclusionary thoughts, and including some of the main things that we've talked about so far.
So I think in line with the theme of leadership and burnout, Sue, that's the purpose of your program. So I'm going to say, if I could just kind of, if I had to sum everything up like in just a few minutes, number one is that the leadership is extremely important. Without clear leadership, whatever you're trying to do, it's very, very difficult. It's just, something that, again, if you don't have a good, clear leadership, things can get done, but it's just going to take a long time. And by the time you're finished, you don't know why you started doing it. So I think to develop us have a strong leadership, number one, we have to have this mindset. The obstacles, the problems are not is something that is not there to make you miserable. It's actually, think of it as an opportunity, and have a sense of strong optimism. And all the people that are working for you, are working with you, are looking to you for leadership. So I think it's very important for you to show this to your colleagues. So number one, problems are opportunities. And number two, you have to share your vision, whatever you're trying to do. The people that are following you, they have to understand why they're doing what they're doing. And if they don't know why they're doing what they're doing, they're not going to follow you. They may follow you for different reasons, whether it's a fear, whether it's because of your position, whether it's because they're just told what to do and they're just nice people. Those things only last you for a short period of time. And you can see this throughout history. And you can see
Absolutely.
this.
People need to know the why.
Yeah, people,
Otherwise, the why is just a
yeah.
dictatorship.
So you got to have a clear vision, and then you got to be able to communicate with the people. Like, this is why we're doing what we're doing. And so, and that's very important, because now that will help you to make sure that your bus, like the Steve Covey talks about, having the right people in the bus. And I really believe that you got to have the right people around you and surround yourself with the right people that share the same vision. And this is something that you have to stay focused, because it doesn't take a lot for you to lose your vision. It's just like playing sports, whether it's football or golf or anything. It doesn't take much for you to lose concentration for a split of a second. Okay. And then the third is that we have to be constantly be inspired. And I thought this is like one of those things that if I know my reason, if I know if I know my why, and I know how I'm going to do it and what I'm going to do, and this would be something that we all going to be able to, we all get distracted. Do we all get distracted? And I'm a golfer. And golfers know it just takes a split of a second to lose concentration, and everything just falls apart. Everything falls apart. And and in order for us to stay focused and stay aligned, is that we have to be constantly be inspired. So I think that's these are some of the, I think there are many other important points, but for me, these are something that I constantly focus on. So whenever I run into obstacles, I think of it as opportunity, and I get excited. And then I have a clear vision that I communicate with my team. And then third, I am constantly inspired. And see, my source of inspirations can be coming from many different places, like talking to you, Sue. And also,
you're so kind. Thank you.
yeah, and then also Jose, like my patients that I take care of. I was fortunate enough to help him, but he is a source of my inspiration, like many of my other patients. As a matter of fact, I just saw a patient just like minutes before I started talking to you, and she inspired me. She was an 85-year-old person who's been married for she got married like in her teenage years, so she was married for many years, and her husband just passed away, and she wished that she would have told them, "I love you more." Like more frequent, more often, and she was almost in tears, and that inspired me. It's like, you know what, I need to show my love for my team continuously. It's not like one of those things that you show love, to your spouse or to your friends, like, okay, I love you, and then you turn around and you forget. No, it's something you have to constantly remind and constantly work at. So
absolutely, that's so
yeah. So
and I think of your point about obstacles, and also your point about hope. The old saying, the hardest part about a trip of 1,000 miles are the first steps.
Yes.
Right. And you can't take the first steps without having some hope that it's going to lead something, and getting that inspiration, right? To take those first steps, it also kind of leads to the innovation. I mean, I think of the obstacles you face seeing patients with diseases we've only read about before, right? Those early first steps to just, try to, make sense out of chaos, right? And confusion, are the hardest ones, but clearly you have that leadership vision.
That's right.
And that co-leadership with your team, right? To just whoever is the expert of the thing that needs to happen is the one that takes the lead. It's not really, person specific. It's expertise specific.
Yeah, right.
Yeah.
And so another thing that I want to mention is that hope is a funny thing. Uh, it's very, very difficult to develop hope within yourself. It's like usually this is something that's inspired, like like talking to your friends. It's like other people really need to help you and give you that courage. So I think building a strong relationship. I cannot emphasize this enough. And developing a strong, meaningful relationship that can be a source of a hope. Because that's where the courage comes in. And then it's the courage and strength that gives you that energy for you to take that first step, which and the main reason why many people do not take that first step is fear. It's fear. They're scared to fail.
Oh,
And I'm going to just tell you, Sue, and you could probably do a whole program on yourself. I could actually interview you
yeah.
about the fear of failing.
Yeah.
I cannot tell you. So I could write the number of times that I failed, I could probably, it's going to be thicker than a Bible.
All of us. All of us. Yeah.
I fail. I'd be happy to repeat this to anybody. I fail all the time, and I'm proud of it. I'm proud of it, and that makes me that much stronger. And so, fortunately, I had the wisdom to know, and when I like which first steps is going to work and which first steps is not going to work. But the first step, you just don't know till you take that first step whether it's going to work or not. And
Absolutely. And that
and
kind
you
of notion of failure, I mean, you can't innovate without failing because
no
it's
no
iterating and
yeah
experimenting and trying.
yeah.
Yeah. So thank you for bringing that up. That's such an important point.
hmm
Is there anything that I haven't asked that you would like to share with our audience or would
No,
be helpful for
Sue,
them to know?
yeah, Sue, I hope you continue this program.
Thank you.
And your program is not just about leadership and burnouts. I think it's a lot deeper than that. It's about wisdom. It's about relationship. It's about getting to know people. It's about hope. And there's just so much different aspects with your program. And I wish you all the best with your program. And I would love to see someone interview you, Sue, because I think you are amazing, and I know obviously I know your story, and I would love to if you want me to interview you one day, let me know.
Oh
I'd
my
be
God,
happy
that would
to.
be great.
Yeah,
Let's do
yeah,
that. That would be
yeah,
that would be really fun.
yeah.
Thank you.
Because the audience needs to know like why you're doing what you're doing. I mean, there's a reason why you're doing what you're doing, right?
Yeah, yeah,
And that's one of the first things that I asked. It's like, why are you doing this, Sue?
yeah.
And
Well, thank you.
I think that's important.
All right, let's do that. We'll get on your calendar. That'll be fun. So, Dr. Donny Saw, yeah, you are so inspiring, and you know, having kind of taken a bit of a dive into your story and also some of the work that you've done in Orbis. I mean, some of the, I mean, that was just one of hundreds of stories that you, and then exponentially even more so because it's not just you, it's the team of healthcare providers, right? Not just physicians, but nurses and physician assistants and techs, who are all kind of conspiring to make the world a better place together.
Mhm.
By restoring not just people's eyesight, but and restore, giving them the ability to navigate in the world and to manifest who they are in the world, and and which is enabling their mental and emotional well-being to thrive as well. So thank
Yeah.
you for all the good work that you do.
Yeah, thank you, Sue. And that just reminded me that I work with many students, young students. So these are, Gen Zs. These are just young people. These are just young students, and I am extremely excited I'm truly excited for our future generation and young generation because I think they're definitely far. My impression of the young generation that I've interacted and I have interacted with quite a bit are, they're curious. And they think in a global term, because the world has gotten so much smaller, whether it was internet or AI, with the technology, the world has gotten much, much smaller because we get to find out what's going on the other side of the earth, like within seconds. So I think people, the younger generation just tend to think more in global term. And I'm very, very excited that we have this young generation that are innovative, full of hope, full of ideas, and who think in a global term that's going to take on the world. So I think it's your job and my job to make sure that we lead them in a right direction and give them some sense of hope. And because I truly, truly want to make this world a better place than I came in, and I hope they would do the same for their children.
Absolutely. And I would
Yeah.
co-sign that with my students as well at the business school. Yeah, absolutely. So thank you so much for sharing that. I think that's a wonderful way to end, talking about impact on students and the next generation to kind of carry the torch and to continue to make the world a better place. Thank you so much, Dr. Saw. This has been Tapping Wisdom. I'm Sue Padernacht. Thank you so much.